The EMS event is a medical knowledge and extrication event. Each member is required to wear full PPE. They may remove their bunker gloves when working on patients outside the vehicle after extrication.
Medical gloves are on.
The equipment for this event includes a vehicle, one live patient and one dummy, a backboard, a C-collar, a BLS medical bag including tourniquets, rolled gauze, folded gauze, triangular bandages, splint material, and a bag valve mask. The team will start by relaying a hazard assessment to the proctor. The hazards are a downed power wire, oil leaking under the car, the highway, the unstabilized vehicle, and the undeployed airbags. After the hazards have been identified, the team must relay to the proctor how they will mitigate them.
All right, so we're going to chock the wheels. We're going to put kitty litter on the oil. We're going to cut the battery to secure the airbags. We're going to call blocker, and we're going to call the electric company to shut off the power.
After the team is finished with the assessment, they will need to approach both patients and triage them.
BSI scene safe.
Calling ALS.
The patient in the driver's side will not be breathing and have no pulse. They will be labeled as blue. The patient in the passenger side will have an arterial bleed and a fractured leg and be labeled red. After the patients are triaged, they will need to be treated. The team is free to choose between splitting their resources. However, once CPR is begun, it cannot be stopped until the event is finished. It is advised that after triaging the patients, to utilize all resources to treat the red patient. The team will need to treat the red patient first by applying a tourniquet to stop the bleed. Once the tourniquet is applied, the team will need to stabilize C-spine and extricate the patient from the vehicle using a backboard. After the patient is safely carried to the transport area, 2 team members may split off to begin CPR on the blue patient if they have not already done so. The team with the red patient will complete a secondary assessment and splint the fractured leg, checking PMS before and after application of the splint. The team with the blue patient will perform CPR via 30 compressions to 2 breaths, utilizing the BVM. Once the proctor tells them to cease treatment, one member of the team will give a report on the event. They will need to identify how each patient was triaged, what their injuries were, and how they were treated. They will also need to identify which patient gets transport priority. The penalties for this event are failure to do a scene size-up and announce hazards, failure to mitigate hazards, not verbalizing PPE needs and the need for additional resources, not calling BSI, incorrect triage for patient 1 or 2, incorrect treatment for patient 1 or 2, incorrect transport priority, anything unsafe for the team, additional harm to patients, anything deemed unsafe by the proctor, and finally, missing or incorrect report. CPR penalties will be based on a 1 to 5 score, 1 being poor and 5 being excellent. The penalties can range from 0 to 2 minutes depending on quality. Tips for the EMS event are making sure your team has a plan going into the event, preparing your gear before starting the rotation, removing headrests for easier patient access, and splitting into 2 teams after extricating the live patient from the vehicle safely.